a lot of times when people come into the hospital, they're in the middle of crisis. So they are in pain, they are feeling miserable, their families are stressed out, and there's a lot that can happen between them feeling like there's too much for them to handle. There's a lot of hard decisions hanging over their head, a lot of people waiting for hard diagnoses, and a lot of future that kind of depends on what happens in the moments that they're with me, and understanding that sometimes what they need isn't what I think that they need, it's what they think that they need. And I think all of what we do is focused and almost centered on that individualized moment for that patient, and stepping into someone's story and partnering with them right where they are. I think that means to my patients that they are more than a number, that they're not just room 308 who's got a diagnosis of hypoxia, that they are a person who has a family and a history and maybe 5 years experience in the Navy when they were 18 and 19, and their life really matters enough for me as a caregiver to stop and to see and hear them. And I think that makes all the difference to my patients. For everyone, whether you're a bedside caregiver or whether you are doing billing or housekeeping or whatever your role is, all of what we do comes back to that patient experience. From leadership, administration, CEO, all the way down, has really supported and created an environment where, as a bedside nurse, I am able to give individualized care. And there have been days where I have needed to pass my phone off while I sat with a patient. But because of the way that Mercy Health has really empowered and structured their even nursing grid and so many different logistics of what they value and how they emphasize care, has created a place where I can do that. There was a patient who had a concern and a complaint. We had a lot going on for him in terms of testing and some therapies and things that needed to happen to kind of move his care plan forward and kind of get him feeling better. But his only concern for the day was he desperately wanted a haircut. And he was missing his appointment that he never missed, and his hair was driving him crazy. And so he was refusing to do anything with our staff until we found a way to get his hair cut. So I went in and talked with him, and my whole staff went in and talked with him, and he just couldn't care less about all of my agenda and my testing and the concerns I had for his health. He just wanted his hair cut. So there was another nurse who was around who was just a great nurse, and he found a way to, we kind of called through the whole hospital, found a hair cutting kit somewhere here in the hospital, ran around, got it, and he agreed to kind of hand off his patients for a little while and give that patient a haircut. And so at the end of the day, like after everything was said and done, that patient was happy because we understood that his main concern for the day was that. And then he was able to enter into the rest of the plan for the day and really engage and feel like he had been heard and that there was a trust relationship established between him and our staff. And it just came back down to a haircut. So I think the individualized care experience really boils down to seeing each patient for who they are, underneath all of the stress and underneath all of the chaos, sometimes really choosing to stop and take the time to get to know each patient in each bed for each moment that they're there. When we can balance the stress of the tests and the labs and all the things on our to-do list as nurses with seeing that patient for who they are and what they really need in a moment. I think that always helps me when I step in that room to put aside my own agenda, my own perceptions, my own thoughts, and really step into what they need for that moment.